management in children. Okay, that's gonna be our topic for today. You're welcome to another edition of my program called Health Talk with Queen Nikki. Health Talk with Queen Nikki. I love to say that. Okay, so today we're going to be talking about pain management in children. So I received a very disturbing email from one of the parents, and guess what, she has given me permission to share it, and so people can learn from a mistake about management of pain. I've discussed something like this, but in sickle cell kit. Okay, if you go to my YouTube channel, you will see it over there. As a parent, I'm talking about this topic in nursing perspective. When your children comes to meet you and they said they are in pain, believe them and act on it ASAP. Because sometimes we voluntarily or ignorantly ignore their pain. And children, even as nurses, whatever patients say the pain is, that's how we're going to treat it. We usually work with the patient that they will be on their cell phone and they'll be like, oh, I'm in pain. Yeah, believe them. Just because they're on their cell phone playing and stuff like that, and they verbalize it that they are in pain, that you don't take them serious. Okay, so now let me tell you what happened. So there's this particular mother that reached out to me, and he said for like a week the son had been complaining about headache here and there. And then she said at initial stage, usually she's always like that. Like she would say, oh, I'm in pain, just for her to go play at PlayStation or go do something else. But she said when it's getting consistent, after 1 week, she now said, okay, something is not right, that she need to take the child to a pediatrician. This happened in Africa. So by the time she would take the child to the pediatrician, the child already have encephalopathy. This is the swelling in the brain, and it was devastated, and at the end of the day she lost the child. So she come across one of my video, and then she reached out to me and she was like, oh, you know what, I love what you're doing on social media. Can you educate your followers about my life experience? You can mention my name. She even told me to mention her name. I was like, no, we're not gonna go that route. Okay, I will just go, please. Children's pain should be taken serious. Like, they need to be taken serious. If the child said they have a pain, especially headache, take it and treat it accordingly. When the headache persists, like let's say 1 or 2 days, 3 days, 4 days, take the child to the primary care doctor or the pediatrician so they can look into it. Every pain in a child, and let me tell you, child can demonstrate pain in different route. Okay, the pain can be sharp pain, dull, intense, low. It can be back pain, front pain, whatever. However, location, you have to look at the pain in, okay, where is the pain located? What is the intent of the pain? What is the severity of the pain? Regardless of it, even if it's mild, acute, chronic pain, anything, take it serious when it comes to children and treat accordingly. Okay, treat accordingly. Don't assume that, oh, that is how. I'll use Lola as an example because that's what I always use in my that's the name I always use in my video. If let's say Lola said, okay, mommy, I'm having headache, mommy, I'm in pain, mommy, I want you to do something about it. My headache is not going. After you've treated with medication or distraction or whatever measure you want to use, and it's still going on, investigate further. Let the child verbalize what kind of pain it is. And when you're treating, there are certain age, especially the toddler. I love them so much. That's why I said I love to work with toddler. I love them. You can role play as a parent. Role play like, oh, Lola, You said you're having pain, right? Okay, show me where the pain is. Is it in your head? Is it in your shoulder? Is it in, and then you smile, role play. And when even with medication, where you're giving them medication, because this set of people, I call them terrible T. If you know terrible T, they don't want to take medication. They don't want to do nothing. They just want to play. But if you role play, you will get their attention. That's why I love them. So role play with them and say, you know what? Okay, if you take the cup and put the medication, and say, if you drink this medication, I will drink it too. Once both of us finish, we'll treat ourselves with candy or cookies or a treat. You will see they will do it. That's why I love them. So role play with them, especially the toddler, to get exactly what pain they are talking about, and then the solution, which is treatment. Okay, treatment. Now, at a nurse, we always preach prevention before the pain even starts. Please make sure your children immunization is up to date. Make sure they are not exposed to any infection, especially respiratory infection. Make sure they wash their hands, very important, with soap and water or hand sanitizer. Make sure when they get to school, when they notice that some of their classmates is sick, they notify their teacher. And also when they are sneezing, they sneeze away from other people, so they don't carry germs up and down. When they touch the donor of their school, you tell them to use hand sanitizer. And I know the janitor in their school should be cleaning all the surfaces. That's their job. And if they are sick, for those children that are in United States, they can take them straight to the school nurse, for further treatment, okay, or further intervention. For Africa, they also have teachers that they can talk to, so they can also educate other parents in making sure those children stay at home when they are sick. Okay, pain is a very crucial thing when it comes to children. Now, there are several ways we can treat pain. There are several ways, but one of the best way is hand washing. That's why I always emphasize on hand washing, and also you use this thing. I don't like to talk about pain medication in my program. I always talk about if they have pain, if it's the pain that require ice, you put ice. If it's pain that require heat, you put heat pack. If it's pain that require distraction, because there are some pain that require distraction, you give it to them. Okay, whatever it is, before you not think about medication. But the bottom line of me doing this video is to tell you guys that you need to take every pain as serious as it is when it comes to children. Now, when it comes to children that I'm talking about a baby till 18 years old. A baby, a day-old baby till 18-year-old. Now, the next question I will get in my inbox is, how do you identify if a baby, a day-old, is having pain? You would know. They cry non-stop. You do everything to console them. They keep crying. They keep crying. You understand? They have nasal flaring like that. You can tell. They are restless. Very, very restless. They have respiratory, increase in respiratory rate. Like, you see them, baby, they like... You can, especially when they are having respiratory infection, you can tell. They wheeze sometimes. For infant, they cough. Those are the times that you need to. You don't have to be a nurse to identify that. You can identify it because the mother instinct in us, we kick in. The father instinct in us, we kick in and say, oh, something is not right. You know your children more than we nurses or healthcare provider know it. So, are you guys promising me that you will take action and take every pain in children as important as it is? If you want more health tips, follow. You see this account, the plus button, hit it and follow Health Talk Queen on TikTok, Health Talk Queen backup business page, and Health Talk Queen 1 on YouTube, and Health Talk Queen on Instagram. Till I see you guys in my next video. Ciao, ciao.